Dr. Kim, welcome back to Cure Connections. We've covered a lot of material already talking about the diagnosis of different types of lung cancers, how we evaluate patients with imaging, and of course, how important the biopsy is. When that patient is sat in front of you, obviously before they receive the tissue diagnosis, there's probably a high index of suspicion that they may well have lung cancer. Suspicious lesions may be seen on chest X-ray or CAT scan. And the conversation may have already been had based on the imaging appearance that, this looks highly suspicious and is almost certainly a lung cancer. But the moment that diagnosis is confirmed for patients, and we look our patients in the eye and say, yes, this is confirmed cancer, it still comes as a huge shock for patients, even those patients that are expecting the diagnosis. We also know that so many patients hear so little of what we tell them in that first initial consultation. How do you deliver the news of the biopsy and deliver the news of what they need to remember on day one?
Yeah, it's never an easy discussion. I think really what's important is it's not about the physician at that point. This is the patient's information, and it's our job as healthcare providers to make sure we transmit that information in a effective and efficient manner, just as you're saying. It really depends. When I see patients who sometimes can handle stress better than others and usually those are the type A's that have their notebooks out and their pencils and they're jotting everything down and they've got their recorder.
I know the type.
You know that they've got a handle. Now, there might be some realization later, but they know what they have to do. Or if they have a spouse who is the type A with them or a friend, that's always a good situation. If you have somebody who is a little more fragile and maybe was hoping for the best despite all the odds, because somebody still wins the lottery. It hasn't been me, but somebody always wins. You see it on TV. Then I think you have to be cautious about how you deliver the information, which is very clear and frank, but more importantly, on what are the next steps and make sure they hear it. You might have to repeat it several times. I've even had one patient who I said, I want you to absorb this. You're not ready to hear what the next part of the journey is. I want you to come back in a few days. And they have my email, so if they're ready in a day, then they can come back in a day. But it is very important for patients especially to absorb the diagnosis and its impact. Mm-hmm. And then more importantly, then be able to turn that next page and get centered on what our treatment is, what our goals of treatment are, what are the things they have to worry about, because right now, they're worrying about their friends, their kids, their pets, their houses, their
and
farms, their jobs.
Sure.
Everything is going through their mind. Sure. And it's not just that they heard lung cancer. It's everything else. And so I get it. It's a very stressful situation.
And the good news is, one of the reasons we're doing this segment is that there are so many potential new treatments available, new therapies, potential to maybe be enrolled in a clinical trial. And we have our own tick box if we want to address, the diagnosis, the biopsy results, treatment, this treatment, that treatment, follow-up, surveillance. And in the end, it's just too much information. Do you try and focus on one thing up front, like maybe the next step, the treatments you've already talked about? Or do you find that patients really want to know the long term? Am I going to die? What's the long-term outlook for me?
Yeah, I try to contextualize everything. I think you've noticed that during our interview. When they say, am I going to die? I say, well, yes, we all are. And I haven't met someone yet who has been able to skirt that, although there may be some fountain of youth or something out there. But that's not in our hands. That's at a higher power, and certainly that's not something I can determine. What I can help determine and be their guide, be someone who helps lead them down a path, and just to try and give them the best chance for success is to outline what the next steps are. And many times patients will want to hear that before the diagnosis.
Right.
They will ask you about chemotherapy or radiation. Invariably, someone always asks at the last minute, well, can we cut this out in surgery? And have to explain the reasons why we can't at later stages. But they want to hear about these things. We say radiation like, anything, but to them, radiation could be anything from a cell phone to a CAT scan to what is radiation for cancer treatment. And so it's important, if you're going to answer those types of questions, to make sure they fully understand what that means. And many of my patients will want to hear before.
And it amazes me that the number of patients that still don't even know the difference between radiation and chemotherapy. We take it for granted, doing that all day, every day. Lots of cancer clinics now, the doctor will work alongside maybe, an oncology nurse practitioner or other members of the team, that when we've delivered the news and maybe seeing 20, 30 patients in a busy clinic, that they can actually sit down, give the patients time to explain things with them. Do you work in the clinic with anybody else to deliver that information?
You want a team. I mentioned a quarterback before, but if the quarterback has no one to hand the ball off to or throw, or someone blocking for them, and I'm using football as an analogy, I don't know why I choose football, but that it's important to have that team. And I work with pharmacists, we have nurse practitioners or ACPs, we have chemo teaching nurses as well. And so we have navigators. It requires every one of these folks, social workers, patient advocates, to make sure that every little bit, even to filling out those darn insurance forms and the job forms, as you mentioned, to make sure they understand what the schedule is for chemo. Gosh, the question of, well, what happens on that day for infusion? I know I have an appointment here, and this shouldn't be like the dentist, that it shouldn't be just a guessing game. Mm-hmm. And so a lot of that education is very important. And giving somebody sheets of paper to read about is not that helpful.
Right.
It really requires some explanation and the logistics. Remember, these type A folks, they want to know, okay, I'm coming in, what happens next? Then IV is placed, then what? Then the nurse comes in, takes your vitals, then we measure some things, and then we get the pharmacy to mix the drug. Then this gets hung first, and then this gets hung second. How long am I in there for? What do I do when I go home? This stuff's in my body now. These are the types of questions that are really important for patients to understand.
I think patients also assume that if they don't understand, that somehow, maybe they're stupid, they haven't grasped what we're telling them. It's a very intimidating environment. And yet I say to patients, if you don't understand what I'm telling you, I'm the one that's failed, and that there should be no shame to ask again, or ask for it to be explained in a different way, or just to hear it a second time.